Hey, future nurses, Dr. Mike here with Rasmeen Kaur, and let's be real, the NCLEX can feel like a mountain to climb. We're here to break down one crucial topic, seizures. Whether you're still in nursing school or prepping for the big test, knowing how to care for a seizing patient is critical. We're talking about potentially life-saving actions, folks, so get ready to conquer your fears and master seizures. We'll cover everything from what a seizure actually to the nursing interventions that can make all the difference. Let's jump right in. Imagine an electrical storm, but in your brain. That's essentially what a seizure is. A sudden surge of electrical activity that throws things out of whack. We're talking changes in behavior, movements, sensations, you name it. Now, some people might just have one seizure in their lifetime and that's it. But for others, seizures are a recurring issue, a condition we call epilepsy. Either way, we need to be ready, right? Let's break down the two main categories, generalized and focal seizures. Think of generalized seizures like a system-wide crash. They affect the whole brain. To remember the different types, use the mnemonic FAG My Legs. Tonic, clonic, absence, myoclonic, atonic. Focal seizures, on the other hand, are more like localized outages. They start in a specific part of the brain. You've got simple partial, where someone might feel tingling, and complex partial, which can cause confusion or even strange behavior. Picture this. You're with a patient and suddenly their muscles stiffen and they start jerking uncontrollably. That's a classic sign of a seizure, but seizures can be sneaky. Some people experience an aura beforehand, like a weird taste or smell. Others might lose awareness, have incontinence, or even turn blue from lack of oxygen. And after a seizure, they'll probably be super drowsy and confused. Keep an eye out for these telltale signs. Chapter 4. Diagnosis, getting to the root cause. Okay, so someone's having seizures. How do we figure out what's going on? An EEG, or electroencephalogram, is like an EKG for the brain. It tracks those electrical signals. We might also order imaging scans, like a CT or MRI, to rule out any structural issues. And of course, getting a detailed history is key. Have they had seizures before? Any triggers? This helps us paint a complete picture. Chapter 5. Treatment and medications. Finding the right balance. When it comes to seizures, our goal is twofold. Prevent them in the first place and manage them when they do occur. That's where medications come in. Antiepileptics are the go-to, like levetiracetam or lamotrigine. Sometimes we use benzodiazepines or barbiturates for acute seizures. And here's a key point. Never stop these meds cold turkey. Always taper them down slowly to avoid nasty withdrawal symptoms. Chapter 6. Nursing interventions, your role in seizure management. All right, nurses, this is where you shine. During a seizure, think safety first. Protect the patient from injury, move furniture, ease them to the floor, turn them on their side to prevent choking, loosen any tight clothing and maintain a clear airway. After the seizure, check their vitals, make sure they're oriented and let them rest. And remember, documentation is key. Note everything about the seizure. Chapter 7. NCLEX. Tips, high-yield facts, acing your exam. NCLEX time. Remember, they're looking for nurses who prioritize safety. So when it comes to seizures, think suction at the bedside, oxygen ready, padded side rails up, and bed in the lowest position. And what's the number one priority during a seizure? Airway. Always ensure that airway is clear. Oh, and don't forget about patient education. Teach them about medication adherence, wearing a medical alert bracelet, and avoiding triggers. Conquering seizures, you've got this. That's a wrap on seizures. Remember, understanding these key points isn't just about passing an exam, it's about providing the best possible care for your patients. By knowing the types of seizures, their signs and symptoms, and the appropriate nursing interventions, you're one step closer to becoming a confident and capable nurse. Don't forget to like this video if you found it helpful. Subscribe to Rasmeen's channel for more awesome nursing content and hit that bell icon to stay updated. Until next time, stay safe and keep learning.